Hospitals, not surprisingly, get the biggest chunk. 34% of your healthcare dollars, that top right-hand corner, goes to hospitals. 23% funding physicians, 19% other, 8% other institutions, 10% on drugs, 5% on capital, other professionals 1%. That's how the healthcare dollar is divvied up. And I guess I want to spend the last few minutes here just talking about whether or not we've got the mix right. Andreas, what do you think?
Well, I think we've got the mix that we've got, and the question is, where do we go from here? And I think it would make sense to me to try and spend a little more of the pot on home care, trying to keep people at home.
Where do you want to take it from?
Well, that's a good question. I think if home care is effective, it may naturally come out a bit out of the healthcare, the actual acute care system. I think in terms of rates of growth, I think physicians in this province over the last while have certainly caught up in terms of their income. That could possibly sort of stabilize.
Ted, what do you think?
Well, Steve, I think we need to take money out of all parts of that system. This is an unsustainable, unaffordable system. 30% of all the money we spend in here is wasted anyway. We need a massive redesign of the system based on patient-centered care. We do not need to be spending as much as we are on physicians. I think we've been incredibly generous to the physicians in the past 4 years. Looking at 44.7% increase in 4 years was the total there. Hospitals are going to have to be brought down through efficiencies as well, and I think massive redesign. Movement to the home care sector, I think, is priority. Home care certainly would be the case.
Carol.
I have to, I mean, it's amazing. I'm agreeing with the two gentlemen on the other side of the room, but I would be very remiss if I didn't also support a move to increase home care's capacity.
Gotcha. Lisa.
Well, this may sound a little bit controversial. I agree with all this, but I think one of the problems in healthcare is that it's a monopoly. And I do think that there is a way to inject competition in the system where people can bid on providing health services. Others have tried, and in some cases do it less than what the public system pays. That's not a private two-tier or hybrid system. That's just, it's publicly paid for, but in some cases privately delivered. You know, factories, hip factories and cataract factories and so on.